Don't you just love the smell of coffee in the morning? Or when you're having a very lethargic day and you need something to boost you up, and then you take a cup of coffee and your energy levels get back to where they should be? Well, I know, because I do that sometimes too. Well, caffeine is a stimulant, and today we're going to talk about stimulant addiction. And yes, this can range from simple things such as caffeine to more complicated drugs such as cocaine. So if you feel like this may be a video that will interest you, a discussion that you may want to get into, then let's get started. I like how that smells, and it tastes really, really awesome too. Anyway, for the past few weeks, we have been having a series of videos on addiction, and we talked about an introduction to addiction. We also talked about alcohol addiction, and we also covered heroin and opioid addiction. And this week, we're going to talk about stimulant addiction. And yeah, caffeine being number one. Let's get other examples of stimulant drugs. So when it comes to stimulant drugs, we have the legal and of course the illegal, the street drugs. So for the legal drugs, we have, in our setup, Mira, Mogoka, we have nicotine that comes in your cigarettes, and of course the caffeinated drinks. So that's the coffee, tea, cocoa, and of course the energy drinks. Then in this category, we also have prescription medication, and these are drugs that are used to treat conditions such as ADHD and narcolepsy, which is basically sleeping sickness. Yeah. Then we do have the street drugs, and that comes to bring us to drugs such as cocaine, crack, ecstasy, ice, liquid eggs, and whatever other name these drugs may adopt. And particularly when it comes to cocaine, it can either be snorted, it can be smoked, it can be inhaled, it can be taken orally, injected as well. Yeah. So what are the effects of taking stimulants? Let me put my cup down. Okay, so stimulants can have some very mild to very severe effects on your body. And when it comes to the physical body, small doses of stimulants can work to increase your heart rate, can also work to increase your blood pressure, can also have an effect on your temperature and make you feel a bit warmer than you normally would. It also makes you go to the washroom a lot, so you pee a lot, and it also can make you very jittery and very restless because it increases your energy. Yeah. And when it comes to the brain or the psychological effects, caffeine and other stimulant drugs can increase your alertness, increase your concentration, make you more talkative than you normally would be, give you a sense of increased confidence, and of course it will reduce your sleep. And that's why we use it for illnesses such as narcolepsy that we have mentioned about, sleeping sickness. Yeah. So however, this can work very, very well depending on the situation. There are people who use caffeine and other prescription drugs, prescription notes, drugs to help them increase their concentration and increase their performance. However, in large amounts and in dependency situations, they can cause overstimulation of the areas of the brain that we talked about initially. You remember dopamine things of the brain? Yeah. So they can act to overstimulate areas of the brain that are concerned with dopamine and other hormones or rather chemicals within the brain, and therefore they can give us a feeling of anxiety. We said you can get jittery and anxious when you take normal doses, but for some people they can actually precipitate panic attacks, and more so if you've had a diagnosis of anxiety or panic disorder, it can help to precipitate an attack. It can also cause headaches in some people and cause dehydration in some, in very large amounts, overdose, it can also give you confusion and make you overly paranoid and just scared of everything and everyone around you. It can also give seizures, it can also cause strokes and a heart attack, and in very severe circumstances it can lead to a coma or even death. Yeah, not something you want to play with, I think. Yeah, there's an ambulance. Someone's sick. I hope it's not a stimulant overdose. Now, when it comes to the withdrawal symptoms, as we mentioned in one of the videos earlier, withdrawal symptoms would normally be on the opposite scale of the normal effects of the drug. So in this case, with stimulant drugs where it reduces sleep, of course in the withdrawal phase you'll have increased drowsiness and increased need for sleep. So you'll also be very lethargic, very fatigued, just drowsy and reduced motivation. You're feeling loss of interest, really just don't want to do anything. It can also give you chills, make you very jittery, and it can also increase the appetite, because we said in the normal effects it can reduce appetite. So here it may increase the appetite, it can also slow down your speech, and it can make one also very irritable, and of course reduce memory and reduce concentration. Yeah, so, and this can last from a few hours to days, and for some people even months, depending on the symptoms. Some symptoms such as feeling depressed or feeling very anxious may take much longer to clear out from the last dose. Yeah, it can take up to months. Anyway, that aside, we move to treatment. How do we help you if you've had an addiction to a stimulant drug? So first and foremost, it will depend on the stimulant drug that we are talking about. So if someone comes with a coffee or caffeine addiction and someone else comes with a cocaine addiction, of course they'll be treated very differently, and this is because of the kind of effects that these drugs do have on the body. So the first thing is, of course, there'll just be a general assessment to see what the effects of the drug are and how severe they've impacted in your life physically and psychologically. So as usual, the three phases. So there's the initial phase, the intermediate, and of course the long-term care. So in the initial phase, we'll do, after your screening assessment, whatever difficulties or whatever issues that will have risen from your assessment will have to be dealt with. If you come in a state of withdrawal and you're dealing with withdrawal symptoms such as being overly anxious or being very jittery or having a panic attack, and then we will need to treat those symptoms during the detox phase. And then of course we'll do a mental health assessment to see if there are other issues that you are dealing with that will need to be addressed. So during the detox phase, we can decide to either stop the drug that you're using cold turkey, or we can taper it off, and this will depend a lot on the drug that you're using, how long you've been using it for, and the safety of either options. Yeah. And then of course yes, we said we'll treat the withdrawal symptoms and then the mental health treatment. Thereafter we move to the intermediate phase, and here is of course your talk therapy. This can be either individual therapy or group therapy or both, a combination of both. And here we're trying to talk about motivation counseling to reduce rather keep you motivated to quit the addiction, if that makes sense. And the other thing here is also to do with relapse prevention therapy. Rather just give you strategies and tricks and ways in which you can adopt within your environment to help you not to go back to using the drug, or rather prevent a relapse, in short. Then of course we have the long-term care, which is follow-up. Basically, if you've been on treatment for a mental health difficulty, or if you need continued therapy sessions with your psychologist, a counselor, psychiatrist, whatever the case, this is where the follow-up care will come in handy. Yeah, and that's basically it. Back to my coffee. Yeah, so that brings us to the end of this discussion. I still have a little bit more coffee to take. Not yet jittery. I hope I don't get jittery, but there are much more alert. Maybe it's evident. No. Okay. If you have any questions, any comments, any thoughts, you can always put them down in the description, in the comment box below, and don't forget to subscribe, please. I think just I don't get what's so difficult. Just subscribe, just like that red button. Just subscribe and like, share, and spread out the news out there. And see you next time in another video on drugs, and this time we'll be talking about hallucinogens. Yeah. See you. Take care.